Breast cancer patients, prior breast cancer patients looking to explant for reasons of breast implant illness or otherwise, the options are much more limited. Many times for patients that have natural breast tissue, we'll offer different types of reconstruction, either a lift for skin laxity or fat transfer for added volume and shape. However, if somebody's is a prior breast cancer patient, depending on what they've had done previously, they may not be a candidate for those types of procedures because there may not be any breast tissue left over. So because of that, a lift isn't generally going to work. A fat transfer isn't going to work because there's not really any breast tissue in patients that have had a mastectomy to transplant that fat into. So commonly patients are left with the option of doing what's called a flat closure, which basically means that we're going to still remove the implant, remove the capsule, en bloc capsulectomy, just like we would in someone that didn't previously have breast cancer. But instead of doing anything with the breast to reconstruct it, we're just going to remove the extra tissue, typically anything that's left over, and make the chest flat with the goal of patients going on to wear a prosthesis, which is something that oftentimes breast cancer patients have to do anyway in the case of a mastectomy, but for this reason, we're doing it for breast implant illness following explant surgery. So we would just remove en bloc capsulectomy and any redundant skin that would be left over. And the other issue with a lot of breast cancer patients is many times because of prior surgery, sometimes radiation, the blood supply to a lot of the critical structures in the breast is already compromised. So we also have less options for reconstruction because of that.